How do TB drugs interact with immunosuppressive medications? When treating tuberculosis in people with weakened immune systems, understanding how TB drugs interact with immunosuppressive medications is crucial. Many patients with compromised immunity, like transplant recipients or those on autoimmune therapy, need careful management to keep both conditions under control. The key players in TB treatment are rifamycins, including Rifampin, Rifabutin, and Rifampin. These drugs are powerful because they target the bacteria directly, but they also affect how other medicines are processed in the body. Rifamycins are known to activate liver enzymes called cytochrome P450 enzymes, especially CYP3A4. These enzymes are responsible for breaking down many immunosuppressants, such as calcineurin inhibitors like cyclosporine and tacrolimus, as well as mTOR inhibitors like sirolimus and even corticosteroids. When rifamycins induce these enzymes, they speed up the breakdown of immunosuppressants, which can lower their levels in the blood. This reduction in immunosuppressant levels can be risky. If the drug levels drop too low, the immune system might become overactive and attack the transplanted organ or flare up autoimmune disease symptoms. Rifampin, in particular, is a very strong inducer of liver enzymes, so it can cause a significant decrease in immunosuppressant blood levels. This means patients might need much higher doses of their immunosuppressants to keep their levels stable. Rifabutin is often preferred in these cases because it induces liver enzymes to a lesser extent than rifampin. This results in a smaller reduction in immunosuppressant levels, making it somewhat safer for patients who need to balance TB treatment with ongoing immunosuppression. Studies have shown that, in liver transplant patients, Rifabutin causes less decrease in drug levels compared to rifampin, but both requiring close monitoring. Even with Rifabutin, doctors need to regularly check blood levels of immunosuppressants to adjust doses as needed and prevent rejection or other complications. Isoniazid, another common TB drug, has fewer interactions with immunosuppressants. However, it can still affect liver function and needs to be used carefully, especially in patients taking multiple medications. Managing TB in immunocompromised patients is a delicate process. Doctors often choose rifamycins with lower interaction potential, like Rifabutin, and they closely monitor drug levels to keep everything balanced. They also watch for signs of organ rejection or worsening immune suppression. Sometimes, if drug interactions are too complex or risky, alternative TB treatment regimens might be considered. In summary, TB drugs, especially rifamycins, significantly impact how immunosuppressive medications are processed in the body. They induce liver enzymes that break down these drugs faster, which can lower their effectiveness. Rifabutin offers a safer profile compared to rifampin but still requires careful monitoring. Always remember, managing these interactions requires a team of healthcare professionals working together to ensure both TB is effectively treated and the immune system remains adequately suppressed. If you or someone you know is in this situation, consulting a healthcare provider is essential for personalized care and safe treatment.